So today I'm joined by Dr. Andrew Winge he's joining me from the UAE, originally an ED consultant in the US.
hmm
And we're going to be talking about harm reduction in the area of anabolic steroid use.
Yes. Yeah. Thanks, Angela. Thanks for having me.
No, it's great to have you
This is a
back.
good one. This is a
Yeah.
good topic.
Yeah, I think this topic is impacting more and more people around the world.
Yeah.
Um, And there's a whole load of reasons for that. And I think we need to sort of unpack some of those.
hmm
Um, the availability of anabolic steroids seems to be increasing, the immediacy of their availability, the internet being a really big source. But I think sometimes there's a lot of misinformation out there. And
Yeah.
so people can come unstuck quite quickly and
hmm
not necessarily really realize sort of what elements, um, how it could be impacting their health and on what sort of scale. Um,
Right.
what's your recent experience been in this field with your patients?
Yeah, I do a fair amount of consults, like we were talking about offline, for guys who are in the bodybuilding community. But also, most of the, as you know, like most of the guys out there that are using PEDs, they have no intention of being competitive bodybuilders. They're doing them for the cosmetic and the aesthetics aspects of it. They're trying to achieve a certain look, I think, that they see on social media. Because as we know, I mean, virtually all of the fitness influencers out there, regardless of what they will admit to publicly, it's pretty clear that all of them are using PEDs and they have physiques that, honestly, like unless you have really elite genetics and are doing everything else perfectly, you're just not going to achieve that look necessarily without some sort of assistance, chemical assistance. So, this is something obviously that started in the competitive bodybuilding and like competitive sports world, but as you were saying, like has leaked into now the general public. I mean, all the way down into the high schools. We have, high school kids.
Yeah.
You can go on Reddit and you hear about high school kids using trenbolone and not to mention SARMs. I mean, that's a whole nother thing that maybe we can touch on as well. Not only are anabolic steroids really not that difficult to obtain, almost regardless of what country you live in, but SARMs are even more easy to obtain. And so, the kids are going to get their hands on whatever they can, easily get their hands on. So this is a big problem, and the biggest way to, or the best way to address it, I think, is just with information, because the sources of information that people turn to, if they look for information at all, are a little sketchy online. You're going to have good information, but it's sprinkled in and diluted out by a lot of potentially bad information. There are bodybuilding coaches out there, some of whom are really good, and they talk about dose reduction and getting routine blood work. But then there's a lot of bodybuilding coaches that the health of their athletes is really not their top priority. They're getting paid to achieve a certain look, and they'll use whatever means, that they think that are at their disposal to get that look. So it's a lack of information. So maybe that's like we can focus today on just giving guys good information.
Yeah.
It might be good to just like briefly mention what harm reduction is and maybe what it's not, because maybe people think about it differently than you and I do. What I will say is, like TRT, what you and I do and as part of our practice is, in my opinion, it doesn't fall under, this is not something that you need harm reduction for. Going on TRT, if you have low testosterone, is harm reduction,
Yeah.
in my opinion. That's a component of optimizing health and reducing harm. You're being harmed by low testosterone. If you have hypogonadism and a lot of the problems that go along with that, you are being harmed. So we're not talking about TRT here. We're talking about high doses of androgens, and specifically, I really focus in on like the synthetic androgens. Testosterone is an issue too, because some of these guys take very high doses of testosterone, but it's these other agents, the trenbolone and nandrolone and all these other like testosterone derivatives that, we know unequivocally have some pretty serious potential problems.
Yeah.
I'm not here to fearmonger, guys. I'm not going to over-exaggerate the dangers of these drugs, but I want to try and speak as accurately as I can about them because they're not risk-free. So harm reduction, in my opinion, is intended for guys who are using androgens in very high doses, often for very prolonged periods of time to achieve whatever goal they're doing. And the important component of harm reduction is that it's not harm elimination. So, abusing these drugs and using them in a dangerous manner, which, is high doses for long periods of time, you're never going to get the risk down to zero, in my opinion. If somebody knows how to do that, please let me know. So we're just talking about doing less damage. I don't know of a way to make trenbolone safe. Again, if somebody out there knows how to do that, please let me know. I don't know how to make 600 to 800 milligrams of nandrolone a week safe in the long term. So it's talking about minimizing harm, not eliminating harm. And I think it's important just to say that out of the gate, because if you choose to go down this path, I mean, there will be harm done to you. It's just, are there ways maybe to mitigate that a little bit? And, we'll talk about that. I think there are, but we're not going to eliminate the risk entirely. So you just got to know what you're getting into if you go down that road.
And I also think the why you're getting.
The why is huge.
The why is absolutely massive.
Yeah.
And I think, we live our lives. A lot of people choose to live their lives online. They get a lot of body images, messages sent to them that they're not even aware of getting sent to them.
Precisely.
It's these young kids that are disrupting their hormones, such an early and important stage in their physical development. And you're kind of thinking, why? And, you take kids back, and I've always said this, women often get sort of told that they get a lot of influence from other people's body images, but I think men are in exactly the same boat.
Oh, yeah. Oh, yeah.
Kids, superheroes and stuff, and they start off with all these very particular physiques that are almost always not achievable without anything. And actually that starts your programming,
Absolutely.
There's competitive sport, but like you say, the majority of people aren't getting into a lot of these drugs in order to use it from a competitive point of view.
No. No.
So
I make that differentiation a lot because I understand if you're getting a paycheck from bodybuilding, which quite honestly, very few competitors are making a decent living. It's only the top, maybe in the professional ranks. I'm not an expert in the bodybuilding world, but imagine it's only like the top 10 or 15 guys are making a reasonably good living. Or if you're an athlete that with sponsorships and whatnot outside of bodybuilding, I understand that the temptation to use these drugs, and quite frankly, you have to use them if you want to be competitive. But you're right; that's different than the average gym bro. Yeah. And that's one of the things that when I do consultations for guys, 99% of which are gym bros, and I don't use, that's not a slur. It's just just a term I like to use. I'm a gym bro as well, but you have to peel that onion, like you said, and get to the root cause. What are you looking for? And most of the time, what I find is that the look that these guys want to achieve, they don't require the dosages and the particular drugs that they're using. Honestly, just in many cases, really learning how to train, learning how to eat properly, and then, okay, if you need to use an agent, something just like testosterone, which at least, even though you may be using it at higher doses than you and I would prescribe, at least that's bioidentical, and the body knows what to do with that, and it's going to have less harmful effects than nandrolone, boldenone, and certainly not like trenbolone and things like that. So maybe you've had a different experience, but I've never talked anybody out of using anabolic steroids completely. I've never got anybody to stop, and I've tried. But what I have been successful doing is in dose reduction and in choosing maybe slightly safer alternative agents to achieve the look. Because again, when you get to that why, many times I think what they're looking for is achievable in a safer route. Now, it may take longer, and that's a big issue, right? You touched on that with social media, and everybody wants it now. Everybody wants the look now. They don't want to put the hard work in. They want it in a year when, if they took a safer path, maybe it would take 3 years to get the physique that they want, but they want it in 6 months or they want it in a year. So,
I think sometimes the psychological impact of actually taking that time out, exploring that why, exploring that if they're ready to do that. But actually, I think sometimes the impact of the stacks that they end up and the sort of the psychological impact of that can be so great that actually their ability to process at that stage can sometimes be and it can be quite disconnecting from other elements from family members, even from socializing. And actually, all the things that they were going to the gym for, which can often be, especially in this age where everyone's working online and working from home and things, that can be quite a connecting element. And, we know and we understand that when we're starting to do addictive processes and sort of going through disconnected processes, that disconnection always tends to speed up that journey as well. So, and it's interesting because, I suppose that would be, it's when people then start reaching out to these online communities, and, they're chatting to some guy on Reddit or whatever, reaching out for really big health advice from somebody who they have no idea who this individual is, no idea whatsoever, no idea about their qualifications, their experience, or often even, does this guy even look the way you're wanting to look? Is he in any way equipped to give this information? But it's the immediacy of the want for those results, I think, is one of the really, really big concerns. And it's just about taking that time to, even like looking in, doing some blood tests, checking your blood pressure, and
basic stuff.
Really, really basic things can just give you, a bit of a helping hand and a bit of a hint to know whether or not there's anything else going on.
Absolutely.
You should be looking at it.
I have found, and I'm sure you can back me up on this, but many of these guys, they don't want to see physicians. They feel, and rightfully so, they oftentimes get dismissed out of hand. If they go to their GP, their internist, if they want to see a cardiologist to get, a cardiac assessment, oh, you're on anabolic steroids. So there's an immediate sort of a finger waving, and you're crazy, you need to stop this. And so, they're not coming there for a lecture. They're coming there to get help. They have a concern. And, almost all of the guys I've talked to in the past have had bad experiences, trying to go through the conventional medical system. So I understand why they go to places like Reddit and these Facebook forums, and they take advice from people that maybe they shouldn't be taking advice for, because at least those people are listening to them and they're taking advice. And quite frankly, that's why I get a fair amount of business about this, because I don't proceed from a position of judgment whatsoever. I'm really just interested in helping these guys out and give them good advice so that they can make good decisions. But you go to a conventional physician and it's a flip of a coin.
Yeah, and I think often, certainly in the UK, we don't really get much information or education about it. So unless
no, exactly.
you yourself,
physicians have no idea.
Yeah. So actually, unless you're choosing very specifically to go down and go and find that information out. But like you say, it's got to be coming from a position of no judgment, but also at the same time being quite clear about the potential.
Oh yeah.
There are any signs or symptoms of health problems coming inbound. I think those things are really important to discuss. But in, in a safe, non-judgment environment,
Yeah,
non-judgmental
yeah,
environment.
exactly.
What do you recommend? Do you have like a process of initial blood tests and things? So when somebody comes in and reaches out to you, then Andrew, where do you
Yeah.
recommend people start?
Yeah, it's that's a great question, and it's going to be different for each man. Obviously, I mean this is an individualized approach, but the first part of that evaluation is kind of what we've touched on already. Is let's talk about what you're taking,
Yeah.
let's talk about why you're taking it, and then we can get into the specifics about dosages and we know what are the goals that you have with this stuff. What are you specifically looking for? And many of them maybe they haven't actually sat and like really articulated that
Yeah.
formally. They have this notion in their head, but it's kind of vague. So helping them kind of narrow that down and be specific, I think, is a really nice initial thing. But I focus on when it comes to the medical parts of this. I mean, we could talk forever because there's so many different organ systems. But if you look at, for example, like autopsy studies on bodybuilders, and there's actually some really great papers. You can go to PubMed and you can find a whole bunch of case series where they've looked at bodybuilders, professional athletes, et cetera, and just recreational anabolic steroid users who have died suddenly or sometimes not suddenly at relatively young ages. Now that I'm over 50, 50 is still young to me. So under 50, and so you see a pattern there. Almost all of these guys, I'm thinking of one paper in particular where they had 12 or 13 case studies. 100% of these men, whether they died from cardiac causes or not, most of them did, had massively enlarged hearts.
Yeah.
So ventricular hypertrophy is a major thing that just we have to address that because it's almost universal with these guys. And I'm not talking about just a little bit of cardiac hypertrophy. Some of these guys have 600-gram hearts, which is like 3 times the upper limits. All athletes, if you exercise, whether you're an endurance athlete or a strength athlete, you're going to have a little bit of cardiac hypertrophy, and that's actually normal. It's helpful. It's called the athlete's heart, and you can differentiate that on an echo or a cardiac MRI. But when those numbers start climbing, with the thickness of the ventricle and the septum, there's a whole series of problems that start, and there's this cascade of issues that affects not just the heart, but then now the kidneys will start to be involved as well. So that's the second organ system that you see a lot in these autopsy studies. And I'm sure, the listeners out there, if you're familiar with the bodybuilding world, I mean, we can rattle off a few names of well-known like professional bodybuilders and social media influencers who have died suddenly from problems in I call it the cardiorenal system because they're both connected. When the heart starts to fail, the kidneys often follow. When the kidneys start to fail, that's not too long before the heart follows suit as well. And you and I see that in our conventional medical practice all the time, both in the emergency room and on the inpatient side, not even with anabolic steroid users, but people with cardiac and renal issues, they often present with both. So those are areas immediately that I focus on. And then obviously atherosclerosis prevention, which is a little bit tougher for guys to grasp sometimes because, that's a long-term 20-year thing. But I really try to emphasize to these guys that, these drugs are going to, in most cases, they're going to accelerate atherosclerosis. So I know that you feel invincible at age 25, but, when you have a 98% LAD lesion at age 45 that you could have prevented, you're not going to feel invincible, and I do see that, So I focus on the heart, I focus on the kidneys, I focus on lipids, and obviously blood pressure. You mentioned that briefly before, is one of those things that it covers all of these systems. So that's a big one that I focus on, and many of these guys have elevated blood pressures. And so it's not rocket science. It's the low-hanging fruit, right? It's blood pressure, it's kidneys, it's heart, and obviously liver gets into the issue. There's liver issues that guys have with orals as well. But That's kind of like tier one for me, is like, let's check these boxes and make sure that we've optimized and everything that we can in the cardiorenal and the vascular system. And then we'll go, if we need to go more in depth or there's other issues we need to go into, we'll do that.
Yeah, okay. So so if indicated, would you see if you can have somebody arrange cardiac MRIs or an echo?
Yes, yeah. Yeah, exactly. So echoes are either easier to get. ECGs are even easier. So, I mean, the guys, if I will say, listen, just go to an urgent care and you can at least get a 12-lead ECG. Let's see if you have any ECG signs of hypertrophy, or let's see if you have, anything else on your ECG. I've sent guys who ended up, they had Q waves on their ECG, which for the listeners is usually a sign of a prior heart attack they were completely unaware of. And oftentimes you can see that on an ECG, and that really gets their attention when that happens. But yeah, then I think an echo is one of the first line things that these guys should be getting. And then if there's abnormalities on echo, or sometimes with echoes you don't always get the best images, or you still have some questions, then I'll refer for a car. I typically I don't order cardiac MRIs. Most of my guys are all in different U.S. states, and they're in different countries sometimes. So I have them go see either their primary for a cardiology referral or see a cardiologist directly. And because the MRI will often show things that the echo maybe is not as good, but MRIs are hard to get sometimes. Yeah.
No,
but they're useful. They're very useful.
They can give you a bit more information, can't they?
The other thing that I really like to get, if possible, is CTAs. So a CT coronary angiogram in guys who I think are high risk. That can be helpful for two reasons. One, I have found some really high grade lesions that guys had no idea that they were sitting on, 60, 70, 80% proximal LAD, which is like the widowmaker artery for the listeners. They had no idea, so they found out that they had that. And then in other guys, you find early disease, which right now is not, clinically relevant, but I think it's really helpful for them to see it, because, atherosclerosis, it's kind of a hard, if you're a layperson, it's a bit abstract. Yeah. Oh, I've got this 20% narrowing. And even some physicians will say, it's no big deal. It's just 20%. But it is a big deal. It's a big deal to have a 20% lesion at age 30, because it's not going to stay at 20. That's going to be an 80 or 90% lesion in 2 decades. And so it makes it more real for them. I know from a population standpoint and a cost standpoint, you get arguments against routine screening like that, but the psychological benefits, I think, for people to see, you can just see the light bulb go off when they look at the screen, and I say, look, you see this thing right here? That's a lesion, and that's a problem. So it helps with compliance, honestly.
Yeah, for sure. But I think and you kind of forward loaded this by saying, I'm not wanting to scare people here, but at the same time, it's not scaring, it's helping people make it.
I don't want to inappropriately scare them. Let's put it this way. There are some things you should be scared of, for sure. Yeah. But the flip side is, go ahead.
No, sorry, I think that goes back to the why, because actually, if your why is to get a particular aesthetic, and actually then you're looking at the 20% occlusion that, as you say, is going to grow, does your why justify that occlusion?
Exactly.
What are the things that you can do to make?
What are you willing to do? Are you willing to pay that price to have a six-pack a year and a half sooner than you could still? Maybe you could still have the six-pack. It just, you're going to have to work a little harder, and might take a little bit longer.
Yeah. Yeah, absolutely. Yeah.
So some guys get this. Some guys will latch onto this, but other guys, it's in one ear, out the other, and that's medicine, right? Yeah. I mean, we have non-compliant patients all the time.
But if they're coming to a physician to ask for their help, and they've got a receptive person who's going to who understands what they're, what they're advising on and understands the area as opposed to just coming at it with judgment. I think
Exactly.
that will be sort of better received. And even, and I think that's the other thing. Sometimes as a doctor, you can get a bit frustrated because you can see one thing, but the patient's outcome is entirely different. Point that you just need to go, okay, well, information delivered.
Yeah. But you have to realize too, and we know this as physicians, I mean, it's sometimes they need to hear this message multiple times. They're not going to get where to the place where we would like to see them get in one visit sometimes. I mean, I've got a former client who's a good friend of mine, professional bodybuilder who, I discovered some pretty serious stuff on a number of years ago. And it's always like, this will be my last contest. This will be my last, and then the next one will be the last contest. But every time I can see him, he's getting closer. He's realizing, listen, I'm going to have to stop this at some point. And I just chip away at him, and eventually I think he will, he'll get there, but it's difficult. It's difficult. There's a strong psychological component, to the way we look, and same with, like you touched on it, with men and women. It's and he's been very honest with me. He says, I love this look that I have. I love the attention. So he gets a lot of online attention and a lot of attention in real life. When he goes to the beach, he just takes his shirt off and walks down the beach, and people are addicted to, the crowds like stopping and looking at him, and that's a hard thing to give up. Like, it's very hard. Some people they don't want to be average. And I say, well, listen, first of all, I say, have you seen average? Like, you're never gonna be average, my friend. Like, don't worry. But that's hard. That's hard. And I can't relate to that directly because I've never had a physique like that. I just don't really want that. But I can understand where he's coming from, and that's something that's hard to let go of, I think, for some men, women as well, the attention from looking a certain way.
And it's that constant positive reinforcement that you're getting from that.
Absolutely. Yeah.
And I think sometimes to a degree that you can end up with a little bit of body dysmorphia kicking in there.
100%. Yeah.
So when you get that positive reinforcement of people being quite sort of awed by the physique you've managed to make, with a bit of negative reinforcement sort of cranked up there with a bit of body dysmorphia, it can be a pretty driving.
It's potent. It's that dopamine is a potent drug, right? And that I think has a lot to do, and that's the challenge. They can, and that's where it's difficult. Like, all of this medical jargon that we throw at them, sometimes it's not enough to overcome that dopamine hit that they get, and it's so intimately tied to their self-esteem that it's too big of an ask for some guys, at least initially.
And I think often, I mean, there's another step here. So actually, when that person does try and commit to a change in behavior, and this is the same with any sort of process, then they're going to expect a massive hormonal disruption if they are coming off something anyway. And then maybe they'll use some medications to try and support their own testosterone production again. And they might have their own side effects, and that creates psychological upheaval. And all of that positive, all the positive feelings that they had while they were taking whatever stack they were on, can actually come with, difficulties and a bit of a crash back to reality anyway. So that process is really, really difficult. And I think that's probably why you touched on it earlier, actually. Asking people to come off anabolic steroids is really difficult, but trying to get them to make for a safer practice and sort of come closer to sort of normal physiological level.
Baby steps.
Yeah, absolutely. But it's making sure that people sort of understand that process and how long it's likely to feel the way it's going to feel, and and try and schedule check-ins and see how they're feeling. And I think also that journaling through those processes can be really
Sure.
helpful.
Sure.
To try and sort of mark so that they can see that they're actually moving forward, because I think they can feel pretty static for quite a long time
For sure.
when they are reducing doses.
Yeah.
Um,
It's tough.
yeah.
Yeah. Yeah. This is extremely challenging. Yeah. It's extremely challenging.
And especially, but it's even more challenging when they're doing it blind, when they don't have that motivation.
Precisely.
This is
Yeah.
what your liver functions look like right now. This is your
Yeah.
kidney function. This is your,
Yeah.
uh, this is your cardiac MRI if you're in a position to be able to get one.
Yeah.
But at the same time, and again, it goes back to that why. If you kind of, your why becomes not the abs anymore, it becomes, a different element of your life, then that might be a motivating factor.
Yeah. Yeah. Some guys, when they finally have children, they're like, oh, I really need to clean up my act. I need to stop smoking. I need to lose weight. But until they had kids, it's just, oh, I'm just living for myself. So I can do what I want.
Yeah.
So,
And I think it's, well, yes, by seeing that has actually been a conversation I've had when I've had a guy talking to me about his kids' expectations about, where they're going to head to. And I think that really changed things for him.
yeah.
And he, interestingly, like a lot of these guys ended up needing to be on TRT because he couldn't
Yeah.
get his testosterone levels back to normal.
Yeah.
Um,
Yeah.
I think there's
That's almost universal, I've found, and maybe you have too. But yeah, I mean that's one of the costs of using these drugs for long periods of time. Is your access is probably not coming back in a meaningful way, not coming back enough for you to be optimally healthy.
yeah.
And I think most guys get that. I haven't had anybody that was like shocked by that.
Yeah.
But you're signing up for TRT for life.
Yeah.
If you are using androgen in most cases. There's going to be outliers, but pretty much signing up for TRT. And you may be signing up for assisted reproduction and fertility help too when it comes time to have kids. So that's the other part of it. When you're 25, you don't think about that.
Yeah, absolutely. There's an interesting study done, and I think they were assessing gonadal function in steroid users, current steroid users, previous steroid users, and people who'd never used steroids. I think it was a sample size of about 130-ish,
Yeah.
and I think they were using insulin like growth factor 3 as a marker for gonadal.
Interesting. Yeah.
And they found pretty much universally that the current steroid users, that marker was reduced,
Yeah.
but the previous steroid users, even if they've been clear of steroid use for a good couple of years, still had reduced gonadal function.
It doesn't surprise me. Yeah, it doesn't surprise me at all. Yeah, because these drugs do other things besides, they do other things besides, purely impact the HPTA axis. They cause oxidative stress. They can directly injure the mitochondria. More so with some agents than with others. So there's things going on beneath the surface beyond just shutting down LH and FSH that I found that most of these guys are not aware of. I think, they understand the hormonal parts of this at a basic level, but they may not understand some of the long-term, like microvascular and, the metabolic and tissue effects to the testicle, to the liver, to the brain, those kinds of things. And we have to deal with that if we're going to take care of them. That's another thing that we have to look into.
But I think it changes people's baseline for sort of that normal expectation. This is how I feel normally. If your testosterone is super physiological and that's what your normal baseline shifts to.
For sure.
Really, really tricky. But yeah, so yeah, I think like overall recommendations are just going to be, reach out to a physician who knows and knows how to advise. I think regular blood tests as well, because I think people are often there's so many different things, and it's not from a a source that you really know. I mean, I think there were some really good meta-analyses done taking 5,000 anabolic steroid samples, and they were finding human and animal cells.
Oh yeah.
So,
Yeah.
yeah,
Yeah.
it's
Yeah.
not-
I know which one you're talking about. Yeah. It was shocking.
yeah.
Shocking. Yeah.
So where they were completely different medications and things, and um,
Well,
yeah,
the blood work thing is important, but I also I would want guys to understand that there are effects. Some of these cardiac effects, specifically the hypertrophy, and some of the direct effects on the electrical system of the heart. Like these are things that don't show up on blood work. So I absolutely encourage guys absolutely get routine blood work, but you can have pristine blood work and still end up with, a dilated cardiomyopathy down the road. And you may have had perfect liver function tests and perfect lipids because these are direct, like cellular effects. They affect, we talked about the mitochondrial effects. They cause fibrosis of the heart muscle itself. So collagen deposition, and you get stiffness in the ventricle so it doesn't fill. Like these are not things that show up on blood work. And that's where the imaging it can be helpful. Looking, there's nothing like doing a bedside echo. I do them at work. And seeing how thick that ventricle is with your own eyes and seeing how, wow, this ventricle is not filling up with blood properly. It's not relaxing and it's not squeezing properly. You only see that with organ imaging. So I don't want guys to have a false sense of security. You're doing a good thing by getting blood work. But if you're going to be going down this road, if you really want to be as safe as possible, you need imaging, just to cover all of your bases. And you just got to make sure too that you have somebody who can interpret blood work properly. There are bodybuilding coaches out there that can interpret blood work well, but there are many of them, they're not physicians, they're not medically trained, and they may not see subtle things on blood work that someone else who's trained might pick up on. So then they might not know the right test to order, and that sort of thing. So it's, you got to find somebody who knows what they're doing, and that's easier said than done.
yeah, yeah, no, absolutely. And so is this how, if people wanted to reach out to you then, Andrew, how would they do that?
Sure. Probably the best way is through my website, manmedicine.com. So if somebody wants to do a consultation with me, you can book it through that website. I have a small YouTube channel. You can leave me a comment there. But getting through to me on the website where there's an email form, guys write to me all the time with questions, and I'm happy to do consultations. I get booked pretty quickly. Time is pretty tight. I'm not taking new patients into my practice currently because I'm full at this point. But if you want to be on a waiting list, you have to be in the U.S. Even though I'm here in the UAE. In the states of Texas, Florida, Utah, and Oregon is where I'm currently licensed. So, as time goes on, I may be opening up that practice to take more guys, but I'm actually at capacity right now. But if you just need some advice, if you want some direction, if you want specific medications, I have a protocol that I use to address all of these different options with different prescription and non-prescription drugs and supplements and whatnot that I can kind of tailor to a guy's individual needs. I do that quite a bit. I'm happy to do that for you. I just want to keep you guys safe. And, I'm busy enough in the ER. I don't need any more business in that department. So let me help you avoid that.
That's awesome. Awesome. Well, Andrew, thank you so much for joining me.
Yeah, my pleasure. Anytime.
And yeah, I'm sure that people have some questions for you, but I'll get your links put on the video.
Perfect. All right. Thanks, Angela. Appreciate it. Cool. All Man Medicine video and audio has been created and shared online for informational purposes only. This podcast does not constitute the practice of medicine or professional healthcare services of any kind, including the giving of medical advice. I am not your doctor. No doctor-patient relationship has been established. This content is not meant to be a substitute for professional medical advice and should not be relied upon solely for that purpose either. The only purpose of this content is to present peer-reviewed, research-backed health information for your consideration. As always, rely on the advice and guidance of your personal physician before undertaking any activity presented here, and if in doubt or not comfortable with said activity, practice discretion. Your health is your responsibility and not ours. Finally, I take conflicts of interest seriously. I accept no compensation whatsoever from any private corporations, including pharmaceutical or supplement companies. You can trust that if I recommend a medication, product, or service, it's because I genuinely believe in it and not because I'm being paid to endorse it.